Yeah, thank you. That was really amazing. So now we'll have our last speaker. We'll be hearing, I'm so happy that Dr. Tracy Barber agreed to give us a presentation. Tracy is a sort of young clinician and researcher in our program who also wears another hat. She is one of the main clinicians in the Transcranial magnetic stimulation program, and kind of a new program at Mass General, that is sort of just developing, and it's a really exciting kind of new technology, new approach that she's going to tell us more about, and something that hasn't been used a lot in the treatment of schizophrenia, but it's a kind of an emerging approach that I think is very, very interesting. So thanks, Dr. Barber.
Thank you for that kind introduction. And thanks for sticking out for the whole day. I have no disclosures. And is there a presentation view? There's no presentation view. Oh, okay. I was told there was. Okay. All right. So today I'll be describing the basic principles of TMS and describe how the versatility and adaptability of TMS really makes it a great tool for treating many different types of psychiatric disorders. And since TMS currently is only FDA approved for the treatment of depression, I will be describing TMS for the treatment of depression and go over some future directions that TMS is going into psychiatry, including treatment for schizophrenia. So I know many of you are probably thinking those are great objectives, but I don't even know what transcranial magnetic stimulation is. So what is TMS? So TMS is a safe, non-invasive neuromodulatory therapy that works by changing neural excitability and activity. And to best explain how this is done, I'll just bear with me while I kind of review some high school physics with you. TMS is based on Faraday's principle of electromagnetic induction. And what that states is that an electrical current flowing through a copper coil or any coiled circuit will induce a magnetic field that's generated perpendicular to that current. And the magnetic field travels until it reaches another electrically conductive material, and it will induce an electrical current on that material. And these principles were then used in the 1980s by Anthony Barker he created a machine that could then change neural excitability and change how the brain activates. So a basic TMS machine consists of a coiled copper wire, which is covered by a protective coating. It's connected to an electrical capacitor, and the capacitor then can give a changing electrical current through the coil. And when that coil is placed on the scalp and a changing electrical current is flowing through the coil, a magnetic field is directed towards the brain, and the magnetic field passes through the hair, the skin, the scalp, the CSF, the cerebral spinal fluid, until it reaches another electrically conductive material, which are neurons. And the electrical signal travels along neurons and can induce neural firing. So how does this work to treat psychiatric disorders? So neurons are electrically conductive materials, which connect to form neural circuits, and those neural circuits are then organized into functional networks within the brain. These functional networks, we know, work together to perform complex tasks like walking. You're trying to keep yourself from falling asleep right now. And these networks, we know, are also affected in psychiatric disorders. I know Dr. Holt talked about the default mode network in schizophrenia and how you see changes compared to people without schizophrenia. And TMS works by not only modulating specific neurons, but by changing the activity within an entire network that might be affected in psychiatric disorders. So while TMS, as you can see, is targeting a specific region of the brain, those effects are propagated throughout. And so you can see in this little cartoon, an electrical current is generated along neurons in the left hemisphere of the brain, and you can see how that's causing changes all the way over into the right hemisphere of the brain. So once we know the networks involved in specific psychiatric disorders, and we know what specific networks we may want to change, then we need to determine what brain target we will be targeting. So TMS can only really change activity on the cortex of the brain. Those changes are propagated to other regions, including deep regions. So once we identify a potential treatment target, we then need to know, do we need to either induce activity within that region? So in the illness, is that region working kind of less than it should, or is it overactive? And so with TMS, depending on the frequency of stimulation, we can either cause neural firing and neural excitation, or we can actually inhibit the activation of neurons. So there's a lot of flexibility with this treatment. So currently, TMS is FDA approved for unipolar depression in individuals who failed at least one medication. And there are several investigative uses of TMS, obsessive compulsive disorder, auditory hallucinations in schizophrenia. And recently there was published the very first clinical trial that looked at TMS in treating auditory hallucinations in people who did not benefit from medications and were on a stable medication regimen. And it showed that TMS reduced symptoms in people compared to sham treatment, so kind of fake TMS treatment. So it's kind of an emerging strategy for treatment in schizophrenia. It's also being investigated in negative symptoms in schizophrenia, so addressing some of the cognitive symptoms, difficulties with attention, memory, as well as some of the emotional and reward-based deficits seen in people with schizophrenia. It's also looked at in post-traumatic stress disorder, generalized anxiety disorder, and autism, and bipolar disorder. So in depression, there have been multiple single-center trials started in the 1990s. So while the first trials are starting now for schizophrenia, in depression, the trials started in the 1990s. And then by 2008, large multi-center trials led to FDA approval for its use in the treatment of depression. And then follow-up trials show that it is very effective in treating depression. A deep TMS system was FDA approved in 2013, and I won't be describing deep TMS here because I primarily use the more superficial TMS, but deep TMS briefly uses rather than using a coil, it uses a helmet where there are copper wires that are arranged in a pattern which leads to generalized kind of brain activation or deactivation. Currently, there are 5 companies that have FDA-cleared devices for the treatment of depression, and most people have, after a full course of TMS, most people have at least 50% improvement in symptoms. So following a course of TMS, people who've failed medication treatments have more than half of their symptoms improved. And 30% of people who complete treatment go into remission.
How many treatments is the course?
I'll go into that. That's a good question. So once you know the functional kind of, so in depression, we know the networks involved that are leading to the symptoms of depression, so we can target a specific region. In depression, we know that kind of this area of the brain here called the dorsolateral prefrontal cortex is, in the left side it's hypoactive, on the right side it's hyperactive. So when you target the left side for treatment, the coil is placed over the scalp, and you can affect activity within that region. And those effects are then propagated to the other regions of the brain, which are affected in depression. And I was hoping to use this kind of simple illustration to show that, the blue regions are kind of hypoactive. They're not working as much as in people who don't have depression, and the red and orange areas are acting too much. They're too active. So within a network, it can have, it doesn't cause changes within brain regions in the same way. By stimulating the left side of the brain, we can also lead to inhibitory changes in other regions of the brain. So by giving treatment, we can then kind of make the entire network to kind of work in this happy medium where it's not too active or too hypoactive, and improve symptoms. So these are this is the basic TMS equipment. So what you would expect if you were coming in for treatment, you would sit in what looks like a dentist chair. You see the machine is next to it. There's the coils, which are circled in yellow, and that would be placed on the scalp in a determined location. And you sit. You're awake, alert, you can listen to music, you can play on your phone, you can talk to the technician, just as long as your head has remained still. So as far as the logistics of treatment, which someone was asking about, so as you can see, this guy's kind of sitting there, he's getting a treatment course, he looks kind of bored, but you, like I said, you remain awake. There are no restrictions on your activities, so unlike ECT or electroconvulsive therapy, you don't need someone to bring you there or take you home. You can go to work. People come in, they get a treatment, they go to work. People come in after work for treatment. The initial treatment course is intensive. It's 5 days a week of therapy per week. So Monday through Friday, you come in for 6 weeks. And then after 6 weeks of treatment, there's a taper period where you only do 2 treatments per week for 3 weeks.
Is it 10 minutes or half an hour or an hour?
So that was my next point. Yep. So thank you for prompting me. So daily treatments, the duration is about 20 to 30 minutes, depending on the protocol that we're using. So like I said, the left side is kind of hypoactive, so we're stimulating it, and that protocol takes less time. It takes 18 minutes. And the right side, if we choose to do that protocol and we need to inhibit that area of the brain, we use an inhibitory protocol, and that takes 31 minutes. So what people experience during the treatment is they feel, under the coil, they feel a tapping sensation on their scalp. And that's just from the coil, which, as you can see, looking at the coil, it's more of a butterfly-looking coil, so it's a figure-of-8 coil. And that's caused just from the tensing of the coil inside the plastic, and you just feel just kind of a force there. Nothing's actually hitting you. It's just a sensation that you feel. And you hear a clicking noise because as the coil is tensing, you hear kind of a clicking. And if any of you have done an MRI, you hear that loud kind of banging noise. Well, this is kind of a smaller version of that where it's just a click. So people wear earplugs during the treatment to protect their hearing. And it's not a very loud click. I can talk to people during treatment and they can hear me with their earplugs in while the machine is clicking. So the risks and side effects, so I'll just go through. So given that it is a very targeted treatment, there aren't a lot of side effects. So unlike medication, where you might have the systemic side effects of affecting your gut or your skin or something else, it's targeting a specific network within the brain that has been affected by the disorder. So the most common side effects are headache. Headache is caused from just the tapping feeling that people have, but that sensation kind of lessens. So over time, if someone were just to be tapping on you over and over again, after a while you kind of start to ignore it, you wouldn't notice it. Same thing with TMS. Initially it might be uncomfortable, but then after a while people get used to it. And then syncope, so vasovagal syncope, which is just passing out. This is not common. It's usually occurs in people who pass out at the sight of blood or are very, very anxious during the first treatment. People usually know ahead of time if they're not feeling well, and they'll just let us know, and we'll pause and make sure they're doing okay before we do treatment. And this would happen only during treatment, so you're not going to go home and pass out. You're not going to pass out on your way home. The other risk would be hearing loss, just from the click, because it's a very regular noise that you hear kind of repeatedly. You could develop a hearing loss within that frequency, but people wear earplugs and no one has complained. We've had people do multiple courses. We've had people do 5 courses of treatment and they haven't complained of any hearing loss. And then the most serious potential side effect would be that you could have a seizure. So since we are using a technique that's activating the brain, if you activate enough, you could eventually lead to synchronized discharges within the brain and a seizure. But it's a very low risk. It's about the same risk as taking any medication, any psychiatric medication. And we try to reduce the risk as much as possible by really individualizing the treatment dose for each person. The other risks would be, because it is a magnet that we're using, you could dislodge or heat any metal that was located in the head or neck. So we screen everyone for anything that could become a problem. Usually dental work is not a problem. If you can have an MRI with it, it's fine for TMS. And then because the magnetic field could damage any implanted devices like a pacemaker. We just have to be very, very careful about treating people with a pacemaker. It's not a contraindication, but it's something to take into account before committing to any treatment. The only absolute contraindication to treatment is the use of cochlear implants. So that's a device that assists in hearing, that's permanently there and has several coils which could heat up during the treatment. And so we can't do treatment in these individuals.
There's no risk of memory loss or brain damage?
No, there is no risk. So the studies, there's a lot of interest in TMS and neuromodulation to actually enhance the effects of, cognitive effects. So a lot of studies in healthy people and sleep-deprived people show that even just a single treatment of TMS can actually improve performance on a lot of cognitive tasks. So I haven't had people tell me that they're, all of a sudden like geniuses, but they do, it does improve a lot of the cognitive symptoms that people do experience during depression. And that's also why it's been an interest in schizophrenia, because of the negative symptoms and some of the attention and memory problems that people experience. So like I said, we try to reduce the risk of seizure as much as possible, so we individualize the dose. So the treatment dose is based on one individual's cortical excitability. So at what stimulation level do we need to give to actually cause the desired changes in the neurons that we're targeting? So to do that, we do what's called a motor threshold. So we use the coil and we target an area of the brain that we know leads to movement in your hand. So it controls the movement of your hand. When we target this region, we send gradually higher pulses until we start to see that your hand is contracting. So the muscles are contracting. So we know every time we send a pulse towards a region of the brain, we're seeing a action potential being generated and propagated through your brain, through your spinal cord, through your peripheral nerves, all the way to your muscle to see a contraction. So that's how we know how to dose people. What level of stimulation do we need to give? And so we ask patients to tell us about anything that could change your cortical excitability. So changes in sleep, changes in medications, changes in drug or alcohol use all have an effect. So we just ask people kind of try to keep everything the same during the treatment, and if there are any changes to please let us know, because we may just have to retest their dose. Identifying the correct target is a really important issue in TMS. So there are non-imaging based ways of determining that. So everyone has different sized heads. So we can't just use the same measurement for everyone. So we use multiple measurements of the head and the circumference of the head, different measurements on the head to determine where is the precise region that we need to be targeting. While this is very good, the studies that have looked at how close to become to targeting when you actually compare that to targeting based on an MRI. And we are within, and most people you get within a centimeter of the desired target, which is very good. It means, you don't need an MRI to plan TMS treatment. But this is still crude, and we could actually individualize treatment by looking at people's MRI, either using functional connectivity imaging, looking at the regions that we actually want to be targeting. So we talked about how functional networks are affected in depression and in schizophrenia. If we could do a scan to actually look at the activity within those networks and then target based on those results, that might actually improve the results for each individual. And then also using diffusion tensor imaging, which looks at the actual white matter tracks within the brain, so the pathways that the neurons are taking to communicate with other regions of the brain. Based on that, we could actually target much more individualized, and then also by other fMRI imaging. So when someone's getting treatment, it's 6 weeks of treatment. So how do we monitor the effects? So we get both just patient reports every week. How are you doing? We also have people do several different questionnaires and several different tasks just to monitor how people are doing during the treatment. The pattern of response varies between patients. Some people respond, within the first week. They're saying, I'm already noticing the improvements. I'm feeling already better. Other people start to respond at the very end. I've had people who, on their session 30 visit, I said, well, I'm sorry, it doesn't, we're not seeing the results that we were hoping for. And then by session 36, they said, oh, wow, all of a sudden I feel so much better. I'm going out more. I have a lot more energy. My mood is better. Things are going well for me. So there is a variability in response, but generally people tend to respond kind of by the midpoint of treatment. And then a lot of people ask, so I go through 8 weeks of treatment. How long will this last? Am I going to get symptoms back within a week, or will it last for longer? So the longest study to date that has looked at following treatment, how people do over time, has only followed people for a year. And what that showed is that most people maintained the improvements that they received from TMS for that year. So we don't know, could that last 2 years, 3 years, 4 years, 5 years? We're not sure. We've had people come in for treatment who've been chronically depressed, have tried multiple medications. In Massachusetts and in most states, to get approved for TMS, you have to have failed 4 or more medications from 2 or more classes. So you have to really have tried a lot of different things before they will allow you to do TMS treatment. And so we've had people who've tried everything, did TMS, remitted, and they've been in remission for years now. So like I said, it was just first started to be studied in the 80s, in the 1980s, and then it was FDA approved in 2008. So the question was, what are the long-term effects? Are there long-term negative effects? So it's a relatively new treatment. We don't know of the long-term effects, but based on how it's working physiologically, we haven't anticipated that there would be any negative effects. Like I was saying, some people do come in, once or twice a year for treatments. And once someone has responded one time to a course of treatment, they do respond for subsequent treatment sessions. So one question that a lot of people ask is, what about medications? Because it's a non-medication treatment, can I go off my meds? Do I need to go off my meds? Or can I be on a lower dose? So, and also because, medication options just either have led to too many side effects, or, you're in a state where you really don't want to be on a medication, like if you're pregnant. So it's an attractive treatment for those reasons. But most people for TMS treatment stay on the medications that they have kind of been prescribed. And the reason why we ask people to do that is that studies have shown that if you have people who are depressed, you give them an antidepressant treatment plus TMS, it really improves the benefits of both. So there was a study that looked at antidepressant treatment with a medication, treatment with an antidepressant medication plus TMS or sham TMS. And they showed that really the antidepressant medication plus TMS together worked synergistically to really boost the effects of both. So, so that leads to the question of, like, can we enhance the effect of TMS? Which I think is a very, very interesting question and leads to a lot of, potential possibilities with how TMS could be used. And what we know is it does have synergistic effects when you combine it with another treatment strategy. People have tried to combine TMS with therapy, and people have also combined TMS with a process of, before every treatment, you kind of do a positive cognitive reappraisal. So you think about how good it's going to be when you feel better, how you're hopeful that you'll feel better, what you're going to do when you feel better, and that kind of positive outlook with TMS does improve the results. So in this study, people ask people to write either a positive or negative kind of outlook, and the people who did the positive outlook and did TMS improved more than people who read the negative outlook before every TMS session. So the future directions of TMS, we hope to identify, more treatment targets, so areas of the brain that we can target to lead to improvements for not only depression, but in other disorders, and also for specific individuals. So individualization of the treatment and improved protocols that reduce treatment time. And then TMS for treatment of other disorders like schizophrenia. So in summary, TMS is a safe, well-tolerated, non-invasive therapy. Improves psychiatric symptoms by modifying brain activity of regions that have been affected by disease. Right now, it's only FDA approved for unipolar depression, and advances in TMS research may increase treatment options in many disorders. Thanks for your attention.